Utah Republicans are covering up their own research on trans people because it didn't fit their own narrative. I'll explain this. Let me read part of this article first. It says, Utah lawmakers sweep their own study on care for trans kids under the rug as they push to ban it. And this is from 19thnews.org. It says, they have no intention of actually using the data, a Utah health provider treating trans youth said. Few Utahns have witnessed the effects of withdrawing trans kids' access to care, as Colin Kuhn, a clinical child and adolescent psychologist who specializes in helping their clients navigate challenges and questions related to gender. The difference between receiving care and not receiving care, they said, is night and day. All of a sudden, socially, their world opens up, Kuhn said of trans clients after they start hormone therapy. Treatment that doesn't start until the client has met with them or another mental health professional for a year or longer. And that's something a lot of people on the right don't know, is that we get mental health counseling in order to be on this medication. Because I've had a lot of people on the right tell me, you need mental health help. But you know nothing about me and how much mental health help I've had. So anyway, back to the article. So this psychologist said they're not just isolating and sitting in their rooms behind a screen. So really quickly, just on my own personal experience after transitioning, I want to talk about that real quick because I know exactly what they mean about night and day difference. I didn't really understand my gender until I was a lot older and I was educated on gender. So after I transitioned, I had no idea how big of a difference it was going to make on my confidence, social skills, everything. But after I transitioned, it just naturally fell into place that way. So yes, 9-day difference for sure. I also had multiple suicide attempts when I was younger before my transition. So it has immense potential on your mental health, on your confidence levels, etc. So anyway, back to the article. In 2023, Utah lawmakers passed what they referred to as a moratorium on gender-affirming care for trans youth. It was then State Senator Mike Kennedy's SB 16. The bill's GOP proponents at the time repeatedly insisted they were concerned for minors' health and safety. Bullshit. So as part of the law, the legislature commissioned an in-depth review of all research into the effects of hormone treatments. As the Republican supermajority now moves toward permanently banning such care in Utah, lawmakers continue to sidestep public dialogue about the results of the research, which concluded that gender-affirming care for minors with gender dysphoria is largely found to result in positive incomes and reduce the likelihood of suicide. This is why it's so dangerous that Republicans are taking away health care for trans youth. Records obtained by the Salt Lake Tribune indicate legislative staff aiding the Health and Human Services Interim Committee initially planned on lawmakers discussing the review's findings after the report's delivery last May. So all of these Republicans refuse to talk about the evidence they found, and when people bring it up, they silence them, and they just keep saying no one should ever transition. This is unfounded, unscientific, and highly delusional thinking. They are denying research, evidence, facts, everything. Over the course of its 6 public hearings held across several months last year, the chairs of the Health and Human Services Committee never included a presentation or discussion of the legislature-ordered report in an agenda. Links to the University of Utah's Drug Regimen Review Center's work and a subsequent reporting offering recommendations for possible policy changes by the state's Department of Health and Human Services were instead tucked into a May meeting outline. There was no explicit reference to the documents at the May hearing, 2 days after the research was delivered to legislators. Lawmakers did not publicly acknowledge the documents until the Tribune reported on them the next day. A fiscal analysis of the 2023 bill estimated taxpayers would spend more than $100,000 on this evidence review. Evidence that they're suppressing, covering up, not showing to the public until someone reported on it. After the Tribune contacted the Drug Regimen Review Center with questions about lawmakers' responses to its work, a spokesperson for University of Utah Health responded with a statement standing by the findings that hormone treatments are safe and effective for trans youth with gender dysphoria. So stop lying, Republicans. Oh my God. Gender-affirming hormone treatments to alleviate mental health challenges like those faced by that client are effective and carry little risk, the experts contracted by the state to conduct the medical evidence review found. After having spent many months searching for, reading, and evaluating the available literature, it was impossible for us to avoid drawing some high-level conclusions. Namely, the consensus of the evidence supports that the treatments are effective in terms of mental health, psychosocial outcomes, and the induction of body changes consistent with the affirmed gender in pediatric gender dysphoria patients. The evidence also supports that the treatments are safe in terms of changes to bone density, cardiovascular risk, metabolic changes, and cancer. So those are all also false claims Republicans are making that hormone treatment causes cancer. No, cis women take these same exact hormones. They say it causes cardiovascular problems. No, it doesn't. Look the studies up. In bone density, there was a new study that just came out that said, because the claim on the right is that trans women have a higher bone density. Nope, they're wrong on that too. There was just a landmark study done that found trans women athletes and cisgender women athletes have very similar bone density, almost the same. So they're full of fucking shit. The pharmacists who read the research and wrote the review added in their opinion there was no evidence to justify policies that prevent access to gender-affirming care for trans minors. Overall, there were positive mental health and psychosocial functioning outcomes. Patients that were seen at the gender clinic before the age of 18 had a lower risk of suicide compared to those referred as an adult. And I can also add that if I had been educated on gender when I was younger, I would have transitioned a lot sooner. And I think it would have had a drastic difference for the better on my own life growing up. And I also want to add, the right is constantly bringing up detransitioning as an argument in all of this. But they have no idea that over 99% of transgender people never detransition. So they're squawking and causing a ruckus over something they know nothing about. Thank you guys for listening. Please like this, share this, share this, share this, get this information out. Leave your comments. I'll be back very soon. Bye.